But that perspective is interesting because truly, I think paramedics are probably the most prepared to go to PA school, because I feel like you get a little cardiology, you get a little pulmonology, you get a little bit of GI, you get some trauma. You know, I thought my experience helped tremendously in PA school.
Yeah.
And you could just gravitate off of like, okay, now you're doing some orthopedic stuff and you have a couple athletic trainers in your class, and we had a psychologist in our class, and we had, you know, so we had a OB nurse in our class, and you just, because your class is so diverse, but your background is also diverse just because you've had, you like in emergency medicine, we're jack of all trades, masters of nothing, right? So we know a little bit of everything to be dangerous, but we're not like experts on one area. So I think paramedics are I just feel like, though I've been told this before too, that the paramedics in a lot of these classes are so much more prepared just because of some life experience and having some exposure to these different pathologies and having to think on their own and come up with different differential diagnosis and hands-on on patients and some procedures. It just kind of just gives you a little bit of advantage in PA school. Not to say that there are other, you know, athletic trainers are less, you know, they're not as good at PAs, or I'm not saying anything like that. It's just, I feel like that helped me tremendously when I went to PA school. And there was just to play off something else. When I applied to PA school was in 2008, because I started in 2009. There was over 1,000 applicants for my class. Wow. That long ago. And there was like 70, I think 75. There was less than 80, somewhere between 70 and 80 people in my class. And when I graduated in 11. So that's how hard it was to get in back then. Yeah. It is way harder to get in now. Yeah. So do not expect to get in the first time, the second time, the third time, even the fifth time.
Sometimes the fifth time.
Yeah. It's not easy. I was lucky that I got in. You know, I applied to 5 schools. One gave me an interview, and I got in.
Yeah. And sometimes it's just the luck of the draw who does your interview in the program. Right. I happened to mesh really well with the person that interviewed me, and that got me in. But if it had been one other faculty member, our personalities may not have meshed at all, and I wouldn't have gotten in.
I interviewed with the one person I wanted to, and the one person I did not want to. Yeah. And one was an ERPA. And so we just kind of hit it off. And the other one was an oncology PA that he just looked intimidating on like the website, and I kind of researched him, but they said to have a question prepared for the person interviewing you. And I was just like, are we any closer to curing breast cancer? And he was just so excited about that question. He just was like, no, we're not. You know, we're not any closer for that one than we are this one. And I was just like, but he really was excited about that question. And I think he just liked that question in general. And I think maybe that just helped with him. I don't know. But it's just, it's not easy. But know what a PA does before you apply to PA school. Yeah. Like go interview some, shadow some.
Yeah, absolutely.
And just get a good idea of know what a PA is.
Everything you hear today from myself and my guests is opinion only and doesn't represent any organizations or companies that any of us are affiliated with. The stories you hear have been modified to protect patient privacy, and any resemblance to real individuals is coincidental. This is for educational and entertainment purposes only and should not be taken as medical advice nor used to diagnose any medical or healthcare conditions.
Well, one misconception I think a lot of paramedics and EMTs have is they catch a glimpse of like what we do in the ER, and it's very different than what we actually do. Because I remember thinking like, gosh, the NPs and PAs, like they kind of just follow the doctor around, like the doctor's doing the assessment, like what are they doing? You know, sometimes they just stand there and they don't see like, well, we're seeing 30 patients that day. Half of them I'm going and getting my own history on and doing my own physical exam. You know, the other half I'm discharging, consulting specialists. So yeah, like if me and the doc happen to go in a room at the same time, I'm happy to just stand there and let the doc do one of these while I watch, you know, and maybe learn something about their assessment. Because most of the time we're not even doing all that stuff together. But when an ambulance arrived, often we'll both be there at the same time. And so you get the impression that the APP is not doing anything, but you know, that's one of our millions of patients we're going to see. And so the shadowing experience, I've had a couple EMTs and paramedics that shadow me in hopes of going to PA school. I try to give them a good glimpse of like, I actually do feel very autonomous. Sometimes it may not look like we're that autonomous, but I've got all the autonomy I want to deal with in a day, you know.
I think you do. I think you look autonomous from our point of view. We just brush up against you though.
Yeah.
I mean, we don't see exactly what you do. And in talking with Tracy, it's so much different than I thought it would be, and, she's, it's always putting orders in, and, and it's there's a lot away from the patient that you don't see.
It's an important point to make.
Yeah.
Most of the job working at that level is not with the patient.
Not with the patient.
There's a lot of patient care that is done in the background. A ton.
Well, and we're the limiting factor a lot of times. The patients are waiting for us to get in there half the time, and so you can't spend a half hour with a patient because we're the thing that's holding up the whole department usually. Imaging's getting done, labs are getting drawn, the nurses have already given the medications. They're waiting for us to get in there and talk to the patient initially, or get in there and discharge the patient, or consult a specialist, or get them admitted. So we're being the limiting factor. We kind of have to use our time really efficiently.